Today on the Direct Diabetes podcast, we're speaking with Elise Marrs, a registered dietitian who is also a certified diabetes care and education specialist. We're going to talk about what causes gestational diabetes and what you should do if you are diagnosed with it while you're pregnant. Let's start out with what is gestational diabetes and how is it different than type 1 or type 2 diabetes? Can you explain the difference between all of those?
Yes, so gestational diabetes is very different than type 1 diabetes and different than type 2 diabetes in the way that it's only during pregnancy. During pregnancy, we have a lot of hormone shifts that occur, especially in the late second and third trimesters, that can cause something called insulin resistance. And it can also make it so our bodies might not produce as much insulin as we need to help lower blood sugar levels for baby. So a lot of women end up with gestational diabetes just during the pregnancy.
Do women who have gestational diabetes tend to have larger babies? And if so, why?
Yes. So what I always tell my patients is that our babies love our sugar that is in our bloodstream. It comes over through the placenta, crosses over to baby, and baby will use that sugar as energy, and they will just grow and grow and grow and grow off of it. We love our babies to grow and develop. However, sometimes they get a little bit too much sugar and they grow just a little too large.
Which women are more prone to developing gestational diabetes and why?
So I see it a lot more in some of our older women. Again, they're not old women, but just older for gestational age is what we call them. I also see it in women who might have polycystic ovarian syndrome or a history of pre-diabetes or some sort of other underlying disease that causes insulin resistance.
When you say it can happen to women who are older or get pregnant when they're older, around what age is that generally involving?
Typically over the age of 34, 35.
What are the best ways to manage blood sugars during pregnancy, would you say?
So during pregnancy, there's a few ways that we can manage blood sugars. What we like to do is to manage everything with diet changes, helping patients learn what carbohydrates are and how to manage your protein intake, your fat intake, and your carb intake, and how to balance out your meals. Another way that can help lower our blood sugars, especially in pregnancy, is exercise. So getting as much activity throughout the day as we can. A lot of people think exercise is just going to the gym, but there's a lot of other ways that we can get our muscles moving throughout the day as well. And if those two things aren't working very well, then we resort to medications. Some doctors use metformin or an oral medication to help lower glucose levels. And then for specifically our clinic and some other maternal fetal medicine clinics, insulin is our first line of defense for lowering those blood sugars.
What are some of the symptoms or indicators that a woman, while she's pregnant, might be developing gestational diabetes? What are some things that they should watch out for?
Oh, this is a tricky one. During pregnancy, a lot of the symptoms of higher blood sugar can be the same as what we would see in pregnancy symptoms anyways, such as having a lack of energy or being more tired. Irritability or mood changes can come with those higher blood sugars. We can see increased urination, people going to the bathroom a lot more or drinking a lot more water as well, can be a sign of the higher blood sugars. Some other things we can see is increased hunger. So patients might have, they might be more hungry throughout the day because their blood sugar is not getting into their bodies to be used for energy. But again, all of these symptoms are kind of things that people experience on and off throughout pregnancy anyways. So it can be a little bit tricky to determine, is my blood sugar high or am I just pregnant?
Okay, that is tricky. Yeah. Well, it's good to, just test, I guess. If you are wondering at all, just make sure you test and find out. How long after giving birth does gestational diabetes tend to go away, and why does that happen?
So within like 12 to 24 hours, we can start to see some changes to normal blood sugar levels. That happens because a lot of the insulin resistance and these blood sugar changes are being caused by that placenta. So right after delivery, we also deliver the placenta with baby. When that placenta comes out, those hormones start to shift back to normal because they're not being influenced by the placenta anymore.
And how should women follow up with diabetes checks after, they've given birth?
Yeah, so according to the American Diabetes Association, we want to get checked about 6 to 8 weeks after delivery. A lot of women will go back to their OB offices and do another 50-gram glucose tolerance test or one of those 1 hour tests. Another option to do is that A1C level or your hemoglobin A1C, which is a lab check to make sure that your average blood sugars over the last 2 to 3 months have started to come back down.
Okay. Overall, how many women are prone to developing type 2 diabetes later in life? If they had gestational diabetes, how likely is it that they could develop type 2 later on?
Yeah, I I don't like the answer to this one. The answer is 50%. So up to 50% of people with gestational diabetes go on to develop type 2 diabetes anywhere from 5 to 50 years after having gestational diabetes. So it's really important to continue making diet changes, continuing to follow up with your doctor, because it could happen at any point in your life where that insulin resistance that you had during pregnancy comes back around and kicks back in for life, unfortunately.
Okay. And can breastfeeding help reduce your risk of developing type 2 later?
Yes, yeah, breastfeeding has so many benefits to it. One of which people don't know about a lot is it helps to lower your blood sugar levels and it helps to reduce those risks of developing type 2 diabetes for you and for your baby, actually. So, um, if you can breastfeed, I highly recommend it to everybody because it has so many other benefits on top of it. But from my standpoint as the diabetes educator, it can help with the risk for developing type 2.
That's interesting that it can also help the baby keep prevent them from developing the child from developing diabetes later. I did not know that. That is really interesting. So, okay, so if a woman has gestational diabetes, is her baby more likely to possibly develop diabetes later in life?
They
Is that
do have a bigger risk for developing type 2 diabetes later in life, and I know they're checking kids younger and younger now, as early as the age of 10 for type 2 diabetes in some school districts if they have a bunch of risk factors. One of the risk factors for kids or young adults that they're checking is, did your mom have gestational diabetes when she had you? So it is a risk factor that plays in when doctors are asking these questions to people that are at risk.
there's sort of a newer type of technology that's helping people manage diabetes. It's doing a great job. It's a huge help. It's called a continuous glucose monitor, or a CGM. Tell us, what is that? How does that work? And do you prescribe these to women?
Yes, so I love to use the continuous glucose monitors. I actually have mine on right now. Um, they are awesome throughout pregnancy. They help women, especially if they're not very good at checking their blood sugar 4 times a day. It's hard for anyone to want to have to poke their fingers 4 times a day, or even have the time to do it if they have multiple kids or jobs or anything else going on. It's great to be able to see what is their blood sugar throughout the day, what's going on, not just with when you wake up or after meals, but your snacks and your activity levels and overnight as well. Um, we love the continuous glucose monitors here. They're easy for me to look at those reports every week and say, oh, everything's looking good, or hey, there needs to be a few changes here and there.
And you're wearing one right now. Does it sync to your phone and you can just keep an eye on your phone?
Yep, so it syncs to my phone and then it can also link to your providers or family and friends if you want to share that information with them as well. So it's really a great tool for you to be able to just see, oh, let me look at my phone really fast and check my level. Hey, I have a question for my healthcare provider about my glucose level. Hey, look, they can just go online and that information will just pop right up for them as well.
Do you have type 1 diabetes?
I do not. I wear them because I'm a certified diabetes educator and I like to be able to know what is going on with my patients, how they feel when they put a sensor on sometimes, to make them more comfortable with the idea of it as well. So, and it's just fascinating to know. There are a few continuous glucose monitors on the market for people like athletes or people with prediabetes that might not be on any medication for anything, but they like to have a little bit more knowledge of what's going on with their sugars in the background.
I have been hearing a lot about people who are really tapped into their health and want to monitor it, wearing them even if they don't have diabetes, just to keep a close eye on everything. It's interesting. Yeah. Well, is there anything that we didn't cover that you wanted to mention to people about gestational diabetes?
I think we covered most of it. I think it's just important to stay on top of it. If your OB hasn't asked you about when your glucose tolerance test is going to be, making sure that you're asking them. OB offices can be very, very busy places. So just making sure that you're staying on top of your care as well and asking about when you need to be checked and being on top of that for your schedules.
Okay, great. Well, thank you so much for joining us today and for giving out this great information to people who follow the podcast, and we really appreciate it.
Thank you.
To hear more Direct Diabetes podcasts, visit directdiabetes.com. Please also subscribe, follow, and rate this podcast. It helps us a lot. Thanks.